Hey everybody, it's O'Keefe, and welcome to another episode of America's Leading Dentist. I'm here with Dr. Amanda Cobb of Cosmetic and Restorative Dentistry of the Keys in Big Pine, Florida, right?
Big Pine Key.
Big Pine Key, and as well as Dream Sleep Center, which is a sleep practice dedicated to helping people with sleep apnea.
Yep.
Correct. Okay, cool. And you have locations in Big Pine Key and Key West, correct?
Yes, so the dental office is just in Big Pine Key, but we see our sleep patients in Big Pine and in Key West.
Sounds like amazing places I want to be. Okay.
It is beautiful down there.
Yeah, I know. You talk to a Chicagoan, they're always like, oh my gosh, can we just go there? It's amazing. Awesome. Well, great to have you on the show. So today we're going to be covering a few different topics. So let me just give you an overview of it. So we're going to cover sleep apnea, the miracle of dental implants, and then we're also even going to cover the power of Invisalign and cosmetic dentistry, correct?
Yes.
Yeah, I know. Super cool. So I want to start with sleep apnea because I think that is one of the most little known, most life-threatening areas that patients don't realize, because I didn't realize that they could actually visit a dental office, but not any old dental office. It's dentists who are trained in treating sleep apnea, which is yours does. Here's what I wanted to frame it with. I didn't realize that 20 to 50 million people in North America right now are walking around with undiagnosed sleep apnea. When people think of snoring, they think of sleep apnea, and then they think of treatment is CPAP machines. And that 74% of people who are diagnosed with CPAP machines are non-compliant, which means they don't use them, which then leads to life-threatening issues for all these people. So that's a lot of people.
It is.
Around us.
Yes.
And when I started looking into this, and I'm going to stop talking, Dr. Cobb, I started realizing that like I had so many loved ones in my inner circle that have all the symptoms that we're going to talk about for sleep apnea.
Yes. Yeah, I first got interested in sleep apnea because I had taken a course at a meeting, and I realized that both of my parents are horrible snorers, and so I started venturing into it and got them tested and treated. And, then life got busy. I didn't really bring it into my dental practice years ago when I first started.
Yeah.
But now I have taken a lot of advanced training and got in with some companies that help me do the medical billing side of it so I can find and treat those patients, because it is a huge problem. And I see them all the time in my regular dental office, and I bring that problem to their attention, and
Yeah.
they had no idea that something was going on. And these are patients that see their doctor regularly, but their doctors are so busy that if they don't bring it up to the doctor, then the doctor doesn't even realize that they have it.
Yeah, which is pretty amazing because actually I was surprised that that a dental practice actually helps assess and identify and then intervene with sleep apnea. But then it actually makes total sense because you're in the mouth all
Yeah.
day long.
Yeah, and we see a lot of signs and symptoms of it when we're just doing a normal exam on a patient. And then, we follow that up with questions and ask them about their sleep habits and some of their medical conditions that are related. And if I feel that someone's at risk, I'll get them to a sleep physician for testing, because I don't do any of the diagnosis
Yeah.
on that. It's a medical condition, but I can absolutely recognize the signs and symptoms and get them tested and then ideally treated.
Awesome. Well, you mentioned signs and symptoms. So I mentioned a couple things like snoring, which is pretty typical. Everyone knows that. But there's also misconceptions about that. So can you share some of the other signs and symptoms that most people might not really know about?
Yeah, so snoring is a big one. About 80% of snorers actually have some form of sleep apnea. We see patients, when I'm looking in someone's mouth, I'll see a patient with worn down teeth, someone that has a small jaw or a lower jaw that's set back farther, somebody that has an enlarged tongue or a narrow airway. We can see their tonsils and see that that's narrowed. So I do see a lot of signs in there. I mean, I'll be working on somebody's teeth on the upper all the way in the back, and their tongue is all over me the whole time. And,
Was that right? Yeah.
and then I'm pretty sure they have sleep apnea when I see that going on.
And
So.
can you explain that a little bit? Just like what actually is going on that means sleep apnea?
Yeah, so sleep apnea is when somebody has episodes at night where they stop breathing or their breathing gets so low that their oxygen starts to drop. So they're not getting enough air when they're sleeping. And that is most often caused by the tongue falling back in the airway and blocking it. So that's why it definitely has a correlation to dentistry, because we deal with the tongue all the time, and we're the ones that are looking at the tongue regularly. And the appliances that we use to treat sleep apnea help to pull the lower jaw forward, and that brings the tongue with it and keeps it from falling back and blocking the airway.
So by using a simple oral appliance, you can bring the jaw a little bit forward, and then it stops the number one issue, which is the tongue blocking the airway.
Yep.
Wow. Okay, so what I didn't realize was that when people stop breathing, and can you give everybody an idea of like how many times like people with mild to severe sleep apnea actually stop breathing at night? Because this blew me away.
Yeah, so somebody with mild would be under 15 times an hour, and then moderate would be 15 to 29.
That means they're stopping their ability to breathe 15 to 20. Think about that.
For at least 10 seconds.
For at least 10 seconds.
Yeah.
15 to 29 times an hour. That's insane.
Yes.
Okay, and then severe would be
30 and above. Yeah.
That's crazy.
Yeah, and I've seen patients that stop breathing, 70 to 90 times an hour, which is a huge amount. And those patients oftentimes will try a CPAP. For severe patients, we recommend CPAPs, but if they can't tolerate it or they're just not wearing it, then what we offer is a great alternative even for severe patients.
So what I wanted to highlight here is that do you mind sharing? You probably have a couple what I kind of want to talk about crisis in the body when you stop. Like I didn't realize that the danger that you had, because I was like, well, why do people die who end up having sleep apnea? Like I didn't understand it. And that when correct me if I'm wrong or add on to this when I'm done, it's like, so what happens is I stop breathing, my body goes into kind of a fight or flight to wake me up. Mm-hmm. And then it starts pushing out cortisol, adrenaline, all these hormones that start getting the engine rolling. Like my heart's got to beat faster and harder, which equals high blood pressure. Mm-hmm. My teeth start grinding to wake me up. And then over time, you have higher risk of stroke, dementia, and these other elements because of the chronic crisis going on in the body due to sleep apnea. What have I left out?
Yeah, it all starts with oxygen. So once the oxygen drops below 90, the body starts having these alarm bells go off. And, the further it drops, the harder the body works to try to get that oxygen out to the brain, especially, and to the rest of the body. So the heart starts pumping faster, trying to move that blood around faster. And in the time that the body's supposed to be resting and the heart's supposed to be, barely working, it's working overtime and it's working almost harder than it does during the day. So, imagine if you're, running 30 miles every single day, you would probably wear out pretty quickly. And the same thing happens with the heart. So the dementia comes more from the lack of oxygen to the brain. All the tissues in the body, if they're not getting enough oxygen, they're not going to be up to their full potential. And, you're not going to be living a full life. And definitely it can cause premature death.
Now, I heard that if you pee a lot during the evening, that's another indication that you may have sleep apnea. Where I always thought as a guy, that just means you have prostate issues going on. So is that, and so I had asked that question, so is that just because you're being woken up and then your bladders, or what's going on there?
So in that process, it's that you're in a lighter sleep, so you're going to be more prone to waking up. So when you have sleep apnea, it's hard to get into a deep sleep, so you're not getting that restful sleep. But there's another process going on where you end up with a lot of pressure in your abdomen, and then that releases a peptide that works on your kidneys, and then they start making more
wake
urine.
you up.
So you actually end up, just making more urine from the excess pressure. So when the airway gets blocked, you get this pressure in your chest,
Yeah.
and then that acts to release a peptide, and the body's trying to remove fluids to decrease that pressure.
Okay, I know our audience does not need to know what the peptide is. What's the peptide? Do you know?
It's natriuretic peptide.
Okay. Yeah. Okay.
ANP.
Natriuretic, like a diuretic. Yeah. Oh, very cool. Okay. Wow. Okay. So then, if any of these symptoms they can relate to, before I do that, I was going to say before they can come in your office. Do you have a story of somebody that you treated and then kind of like their before and after story?
Yeah, so I had a patient that I treated kind of early on when I was starting to treat sleep apnea, and she was a mild case, but she was snoring, and she was a very petite woman, so not the typical, patient that you would think would have sleep apnea.
Yeah.
So, but she had a smaller jaw and, had some of the signs and symptoms, so we got her tested. Her oxygen was dropping, I think down around 80% at night. So she wasn't having a lot of events, but her events were bad enough that her oxygen was dropping. She was also snoring to the point where it was disturbing her husband. So we got her into an oral appliance, and all of our oral appliances are completely custom made. We use a digital scanner, so we don't even have to take impressions. And we get the scans of the teeth. We send them off to the lab, and it's so precise that they almost always just snap right in without any adjustments.
That's amazing.
And what it is, it's an upper and lower mouth guard, and then they have a connection between them that helps keep that jaw forward. Yeah. And, with hers, just in her very first set where we didn't have it adjusted very far forward, she already felt tremendous relief, and she was sleeping better, and she wasn't disturbing her husband. We did do a little bit of testing to check on her, and we advanced her a little further, but she's doing great and is super happy.
That's amazing. The question I want to ask you too is when people think of sleep tests, they think of sleep lab, wires all over their face, and a scary guy looking through the glass. That's old. That does not happen anymore. How do people get sleep tests now?
So there are still sleep labs, but the vast majority of patients can do testing at home. Okay. So what we do is we use a company called sleeptest.com, and we set up them for the referral, and then they do a telemed visit with a sleep doctor. So these are board certified sleep physicians. These guys really know their stuff. And then they ship our patients a device to wear for 2 nights usually. They wear it, they ship it back, and then we get everything we need to get the patient treated, and we get all the reports and the data back from them on our online portal. Yeah,
I love it. And then you can do all the rest of the work in the office. It's amazing.
Yeah, and we even, for patients who are just kind of questioning whether they might have something going on, I actually have a few devices in my office. It's a little sleep testing ring that they can wear, and I send those home with patients complimentary and let them wear it for a night, and then I get a full report back on what happened while they were sleeping. And I can't get a diagnosis off of that myself, but I can show them, look, this is what's going on.
This is what I can see right here.
Want to get you a full test.
That's so amazing. Yeah. That's great. That's great.
Some people are kind of on the fence, not sure if they have it, and. They're always concerned about the cost of the sleep testing, but
let's talk about it.
This company will bill medical insurance, and they keep the costs very low. Even if someone was completely uninsured, I think at most they would spend $500 for the consults and the testing. So it's well worth it to make sure that your, health is okay and that you're gonna live a long, healthy life.
Yeah. So let's talk about it's kind of a non-negotiable, honestly, when you start looking at it. So I love that you're sending patients home with is it a ring you said?
Yeah, it's called a sleep image ring. And we actually just recently purchased some other ones called the Balin ring, because some of our patients were having trouble with the other ones connecting to a phone. And so
Okay.
we got ones that are a little easier to use.
So it's like a soft check. You can figure it. Yeah. And then let's talk about like then. Okay, so I go get my consult. I definitely have mild to whatever might be a treatment in your office. Then what would be the protocol from there? And then what are my options from a pricing cost perspective?
So, if a patient is a good candidate for the oral appliance, then we get them back in, we review their sleep study results and kind of let them know what's going on and what their options are for treatment. And then for the oral appliance, we do work with medical insurance and we work with Medicare. So we're able to get these patients into a device for a pretty reasonable cost. Now, it varies tremendously with medical insurance based on what their benefits
Yeah.
are. But we have options where, we can sometimes bill out a network, sometimes bill in network, and we give everybody a complimentary benefit check so that we can see what their benefits are and
Right.
give them an estimate of their out of pocket.
That's right.
At the very most, if someone's benefits are not good and we need to just do a cash fee, we charge $3,500, and we offer financing options so that the patients are able to, make some lower monthly payments even out over a couple of years if they need to.
Yeah. So 3,500 divided by a couple of years, worst case scenario.
Yeah, I mean,
Comes
they
out
can
to,
spend
I
as
mean-
low as maybe $150, $200
Yeah.
a month even.
That's right.
Yeah.
I just got my 13-year-old braces. And I saw that, like, I was like, oh, braces. Again, it's my fifth child through your office. Are there any fifth child discounts? No, sir.
Yeah.
We actually add 10% on you. When they find out we go to Catholic schools, they add 30%. That's a joke for any of you Catholics out there. You'll get it. Okay. Sorry, I can go sideways in some of these jokes. That's pretty amazing. So is there, on the sleep side, is there anything you would want people to know in order to come in? Like, do you do a free consultation or
Yes.
you do? Okay.
Yeah, we do free consultation, and we try to make it as seamless as we can to get patients tested and treated. And we also, if we feel they would be a better fit for a CPAP or another treatment, we can help them set that up, and we communicate with their medical doctor's offices
Yep.
and let them know what's
Yep.
going on and
Yeah.
try to make sure we're getting everybody involved.
That's right. This is not like one of those treatments where it's just aesthetically cosmetic or like Botox or something where we want your business and no one else can have it type thing. Like, this is life threatening. So
Yeah.
I know Dr. Cobb we want to make you healthier and safer and in a better spot. So on this video somewhere, you'll see a link to, Dream Sleep Center, sleep practice. And please fill out the form there or give Dr. Cobb's office a call. Get your free consultation while you're thinking of it, whether it's for you or a loved one. And just find out the facts. It's no obligation, no pressure. It's free.
Yep.
It'd be amazing.